Attention Caribbean clinicians. This Friday from 11 a.m. to 2 p.m., there's a training program on Carnival in emotionally focused couples therapy. One of the presenters is Dr. Cindy Goodness Zane. Who is Dr. Cindy Goodness Zane?
Wow, Denise, thank you for that warm welcome. I'm honored to get to be in the EFT Caribbean community this Friday to talk about carnivaling in EFT, enactments, and tango move force. It's a joining of two island cultures. I live in Honolulu, Hawaii, on the island of Oahu. I am of part Hawaiian background, as well as Japanese, Chinese, Irish, Indian, French, and Portuguese descents, of which I most strongly identify to my Hawaiian and Japanese roots. And just in the course of life, I've met people from the Caribbeans, and in getting to know each other, because we love to get to know where are you from in Hawaii? And in getting to know friends from the Caribbean, we started to share ways of living and cultural practices woven into our attachment systems and our values.
So, what inspired you to connect Carnival and EFT?
Well, in getting to know my friends, they would talk about Carnival every year. I heard so much about it, the colors, the lights, the liveliness, the music, the dance, the warmth, the joy. It spoke a lot about EFT. We're looking at connection and warmth and the dance of our clients and couples, both within and between. And we're reading the emotional signals that may be empathy, reactivity from pain, and a blend of both. When we know how to read those and use where the client is in that moment to inform us, that loosens the blocks to connectivity and bridges steps closer to connectivity. To me, that's Carnival.
Do you hope participants will take away from this activity?
I hope that they will take sort of feeling the colors and the dance music and how to read it. We worked hard to unpack and cultivate the enactment, a new way of sharing. It's precious, vulnerable, and they take the risk to hold it out to their sweetheart.
How can the principles of EFT be applied year-round?
Sue used to say, tea is not just a model of therapy. It's a way of being and living. When we see what's in front of us with the human beings in our offices, clinical settings, out with our friends, family, our children, other families, you can't just shake what you've come to learn and embody. It's a way of engagement, no matter what your setting is. It may not always be for therapeutic purposes, but it's relating.
Remember, this Friday from 11 a.m. to 2 p.m., Carnival and how it relates to emotionally focused couples therapy. Thank you and goodbye.